Hi, my name is Matt Perry. Isaac McBride and I are here to tell you guys about what is forensic nursing. This topic was very interesting to me, as well as to Isaac. It was an area of nursing that I didn't know existed prior to researching it, but I know Isaac and I both have had um, interactions with forensic nurses or patients that have needed forensic nurses. Between Isaac and I, he's a firefighter, I'm a retired firefighter. We've had many patients that have needed the care of a forensic nurse. So, what is a forensic nurse? A forensic nurse is somebody who takes care of patients that have dealt with some sort of tragedy, whether the tragedy is rape counseling or somebody who has been involved in a rape or child abuse, child neglect, but not even children or that. It could be even mass casualties or elder neglect or elder abuse of that sort of thing. So it doesn't matter what type of tragedy that the forensic nurse would be somebody that could come in to assist with that type of situation. The scope of practice of a forensic nurse is very, very broad, they cover many different areas that they take care of. The first one is assessment, diagnosis, planning, implementation, evaluation, and scientific inquiry. This has to do with the investigative portion of their job. They're going to investigate, they're going to assess, diagnose, they're going to do anything that has to do with the crime or potential crime. Something else I didn't mention that forensic nurses take care of is also death investigations. The next area of their scope of practice is identification. So they're going to identify the pathogen, what caused the crime or the action of the harm that was caused. The episodic care. The episodic care is they're going to be taking care of patients of different populations. So it's not a, as a bedside nurse, they're going to be taking care of patients, at the bedside. They're going to be doing the same thing over and over. As a forensic nurse, they potentially aren't going to be doing the same thing over and over again. It's going to be more episodic, so they'll be taking a patient here and taking a patient there. So that's what the scope of practice being episodic care. The collection, preservation, transfer, and analysis. So their job is going to include the collection of data, collection of items that could be used, and they're going to preserve the items from the investigation. They're going to transfer, and they're going to even be part of the analyzation of the data of the specimens and samples. That's the words I'm looking for. So they'll actually be at the crime scene and collecting the data. They're going to preserve the data so that it gets from point A to point B, so that when it does come to the point in time where they're going to testify in court, that they can say that the chain of command of the samples was followed. They're going to participate, so they're going to be there with the police officers, with the other departments that are going to be investigating the crime. They're going to be, but they're not only that, but they're also going to be participating in evidence-based practice, just like nurses at the bedside. They too also will follow evidence-based practice. They're going to utilize every bit of data that they can, every bit of knowledge that they have, every bit of just thought process that they're going to use to be able to take care of these patients and to investigate the crimes that they need to be. They've got to be at the administration and organization and coordination of the forensic of all the forensics that they're going to be in coming in touch with and coming in contact with. They're going to evolve and be involvement and influence in both the internal and external systems. So the internal systems are the professional and societal regulations of forensic nursing practice impacts public health and safety. And that's quoted from the scope of practice for forensic nursing. They're going to develop and support. So they're going to develop programs, and they're going to develop their investigative techniques, and this to support law enforcement and support not only the law enforcement but also the patients that they're going to be coming in contact with, and the victims that they're going to be coming in contact with, and even the bodies that they're going to be coming in contact with, just throughout the whole entire process. They're going to be promotion and accountability, and according to an ethical paradigm within forensic nursing. So all of these items are their different parts of their scope of practice, and Isaac is going to take it from here. Oh, development and promotion. One more thing. So that is going to be education programs for the general public. So now Isaac's going to take over for me from here.
Hi, my name is Isaac McBride, and I'm going to be talking about forensic nursing, starting with educational preparedness. To be thoroughly prepared for a complete forensic nurse, you must complete an accredited nursing program. Forensic nurses can fall into both of the two categories, depending on their education and maximum educational degree executed. Registered nurses typically have as a minimum an associate's degree as well as expert licensure via their Board of Nursing. Nurses with advanced levels inclusive of a doctorate of nursing practice may additionally select to come to be a nurse practitioner, which includes its very own licensing process. No matter what stage of nurse a forensic nurse wants to pursue, they'll need to use licensure from their country Board of Nursing and meet all their requirements. Generally, at the minimal nurses expect to sit for their NCLEX exam, provide nursing training records, and post a background check as well as fingerprinting. Within the forensic nursing forte, there are also a number of certifications which can be had even though no longer legally required. Other professions that interact with forensic nurses are death investigator, as well as police, fire rescue, medical legal consultants, psychiatric nurses, and sexual assault nurses. Necessary skills and abilities required for this role. Professional forensic nurses require a dedicated nurse who has emotional stability, required to work or to interact with patients suffering from diverse diseases and heinous crimes. A forensic nurse has the skills to master and promptly deliver competent trauma treatments. A forensic nurse should also be detail-oriented with strong analytical skills that are important and helpful. These insights are used in criminal investigation. Forensic nurses have organizational skills to record evidence and should be able to communicate clearly with what findings are there. This should be done by avoiding the threat of tampering with the evidence. Also, forensic nurses should possess interpersonal skills to communicate their findings of law enforcement, especially when they are communicating. Forensic nurses should be caring and sympathetic to care about victims during the most terrifying moments. Something unique and interesting that I've learned was one thing from the nursing role in my research is to be your patient's lifeline. You become patient's advocate and their lifeline because we live in a world where productivity is given role number one. Since doctors are pressured a limited number of patients per day, this leads to poor patient care and medical errors. Therefore, as a forensic nurse, you have a unique opportunity to counterbalance these kinds of issues. As a forensic nurse, you encounter a lot in the field and you have to be the catalyst of patients' recovery. This is something unique I learned about forensic nursing, and I am sure there are many more about nursing. This is very interesting, and I wish to have such kind of an opportunity in my life.
Something unique and interesting that I found about forensic nursing is how important they are. I never knew what a forensic nurse was until I started researching this topic, but now that I've researched this topic, I realize how important they are, and how much of an asset they are. They provide with lawyers and police a unique perspective from their medical background, that they're able to help investigate crimes that others have committed and help other people, and just bring that knowledge that they have of the medical side that police officers typically don't have. And that's what I found very unique and interesting about forensic nursing.